To give you an overview of today's webinar, this webinar will cover a brief overview of our State of the Air report and provide an introduction to the connection between air pollution and cancer. We will then walk you through our analysis of air quality and state cancer control plans. Additionally, we are pleased to be joined by a guest speaker from the University of Northern Iowa who will discuss her contributions to the Iowa Cancer Plan and how the plan addresses air pollution as well as lessons learned. Finally, we will spotlight some lung association resources that may be of interest to you, and we'll have time at the end for Q&A. So I'd now like to turn it over to our first speaker, Will Barrett. Will Barrett is the Assistant Vice President for Nationwide Clean Air Policy at the American Lung Association. Will leads the Lung Association's work on clean air and climate change policy and serves as a policy lead, media spokesperson, and contributor to State of the Air and other Lung Association research projects. So I will go ahead and turn it over to Will.
Thanks, Elise, and thanks everyone for joining the discussion today. We really appreciate it and happy to be with you and have a really wonderful discussion here about ongoing work together to protect and improve public health. So I'm going to speak today about the State of the Air report and specifically findings around particle pollution and how that connects to the state cancer plan. So starting with the State of the Air, we first published this report in the year 2000. It's effectively a report card on local air quality information. And basically, this provides every year an update on air quality progress, challenges, and strategies for reducing the harmful effects of pollution exposures across the United States. What we do is we look at two widespread pollutants, ozone, sometimes called smog, and particle pollution, sometimes called soot. Today, I'm going to focus on the particle pollution findings, which have the direct connection to cancer impacts and ways that we present the data as a way of both educating the public and trying to spur action at the local, state, and national levels to reduce particle pollution. Next slide, please, Elise. So here you see basically an illustration of what are fine particles, or what's sometimes called PM2.5. These are tiny bits of solids and liquids in the air we breathe. It's sometimes called particulate matter, PM, or fine particles. And basically the illustration here you see is the width of a human hair in comparison to the size of the particles that we're reporting on in State of the Air. In this case, PM2.5, very microscopic particles that are so small they can, when we breathe them in, they can bypass the body's defenses, get deep into our lung tissue, and even cross into the bloodstream. And what that means is that we're dealing with respiratory issues related to particle pollution exposure, cardiovascular issues related to particle pollution exposure. And we know that there are differences in short-term spikes in particle pollution health effects, as well as longer-term exposures that can lead to broader health impacts. So ultimately, just wanting to highlight just how fine these particles are, how small they are, the damage that they can do because they can get so enmeshed into so many of the body systems and leading, in some cases, to lung cancer. Next slide, please, Elise. So here you see kind of an illustration of the many ways that particles can affect our health. This is based off of decades of literature in the scientific literature on research into particle pollution and health impacts, whether that's in terms of short-term spikes in pollution, which I'll talk about in a moment, or again, those longer-term exposures where people are living in communities that have high levels of particles throughout the year. So even at relatively low concentrations, particles can be very dangerous to breathe, triggering illnesses, hospitalizations, and premature death. Long-term exposure to particle pollution can mean a higher likelihood of developing lung cancer. And I should note too that there's, the focus on lung particle pollution today within the State of the Air report is just one element of the number of toxic air contaminants that can lead to various cancers. And again, wanted to just highlight in the course of this talk what particles can do to our health. And here again, you see there's a wide range of negative consequences, including, especially with longer term exposures, the development of lung cancer. Next slide, please. Here to just kind of set the table for some of the key sources of particle pollution. There's a variety of ways that particle pollution gets into the air. A lot of it deals with the combustion of fuels, whether that's uh, gasoline or diesel or coal. These carbon-based fuels that are being burned in various industries lead to a lot of the development of particle pollution. There's also the issues of burning biomass, burning wood in either, for residential heat or industrial processes, but also increasingly for wildfire issues. And so one of the key areas where states are taking action around reduction in particle pollution is really focusing on diesel exhaust. And this is classified as a carcinogenic compound by the World Health Organization. It's a key factor in a lot of state level and local actions designed to reduce diesel exhaust from trucks, for example, through whether that's idling or truck programs that target cleaner vehicles, cleaner fuels, that kind of thing, and the transition to electrification to reduce those harms caused by particle pollution. And again, a lot of the other areas that are illustrated here, whether it's cleaning up the power sector, reducing the impacts of coal plants, for example, or looking at ways that we can help reduce the impacts of burning wood for residential heat, those kind of things, transitioning to cleaner technologies can all be helpful ways of reducing the exposures that people are experiencing from particle pollution that causes so much health damage. Next slide, please. So here in the report for the 2025 State of the Air report, what we saw, unfortunately, was a significant continued growth in particle pollution, and many parts of the country seeing higher levels of pollution over past reports. More than 70 million people living in counties that received a failing grade for particle pollution measured on a 24-hour basis. We call this spikes in particle pollution, where the particle levels increase on a given day to levels that are unhealthy, and again can trigger that range of health consequences. What we're seeing in the report in recent years has been, especially with the increase in wildfire activity and particles in wood smoke spreading across the country, we're seeing more and more people and communities exposed to particles that maybe haven't been in past years because of those local controls that have come around due to decades of implementation of the Clean Air Act. But with the increased, scale and scope of so many of the wildfires, especially in the West and Canada, blanketing much of the country in the United States with heavy doses of particles, we're seeing that translate into more and more communities showing up in our study in that report card with failing grades for particle pollution on a short-term basis. So the last thing on this slide I'll just mention is what we're seeing with wildfires, not only the increased number of unhealthy days on top of those local sources of pollution, but the severity of the particle pollution levels on those days when wildfire smoke is in the air have significantly increased. And we're seeing on the air quality index, the kind of scale of the severity of given day, air quality on a given day, we're seeing more of those days and just higher and higher levels of pollution concentrations in the air when we see these massive wildfires happening. Next slide, please, Elise. And here, basically, in the report, we illustrate our most polluted cities list. What you see here is a lot of the most polluted cities in the United States in terms of those spikes in particle pollution are in the West, and many of them are in California. Bakersfield ranks #1 in the country, but the San Joaquin Valley in California has long been the most difficult air particle pollution challenge to deal with in the United States. We see a lot of the times where there are valleys, whether that's in Arizona or Alaska, it doesn't matter. Valleys tend to collect particle pollution, and if there isn't a good dispersion of the pollution, it can hang around for days or weeks on end and really build those health effects on the community, or those negative health effects on the community. So again, here wanted to just illustrate a lot of the highest spikes in pollution are showing up in the Western United States. Again, a lot of that is the homegrown pollution sources, those trucks and trains and ships and ports, those kind of things, but also that added layer of pollution from wildfires is creeping in. Next slide, please, Elise. Here, just kind of a highlight of, or depending on how you look at it, a low light of the number of people in the United States living in communities that fail to meet the particle pollution standards, the National Ambient Air Quality Standards for particle pollution that were just set last year by EPA in 2024. Ultimately, 85 million people in the United States receive a failing, or live in a county that receives a failing grade for annual levels of particle pollution in the most recent State of the Year report. What we're seeing again is that the impacts of wildfires are inching up those annual concentrations of particle pollution. And basically looking at this, this is basically an indicator of the urgency of continuing our strong implementation of the Clean Air Act and reducing particle pollution by setting health protective standards that are based on science and following through on all the steps that go along with setting standards and making sure that local communities are taking actions to meet those standards to reduce the particles in the air and avoid the dramatic health consequences that can follow with unhealthy levels of particle pollution. I'll mention here again that the wildfire impacts are significant. In the 2025 State of the Air study, that window that we looked at for a 3-year data set includes some significant transport of particle pollution, again, from the Western United States and from Canada throughout much of the country that hasn't dealt with as much wildfire smoke as the Western states have. But now we're seeing that, again, the impacts of that widespread particle pollution dispersion through the wildfires. And then for my last slide, Elise, if you could change it, really just looking again at for communities with the largest or the highest concentrations of annual levels or year-round levels of particle pollution. Again, we see the distribution a lot in the Western United States, but increasingly we're seeing that broaden with the expansion of wildfires, where a lot of communities have had good controls, good progress under the Clean Air Act. Again, decades of implementation of cleaning up industry, transportation, on and on. We're seeing some of those gains impacts reversed because of wildfire issues and the increased particles that follow. So you see here the distribution in the West, but also into the Midwest and the South, that we continue to keep an eye on and report, because we know how important it is when people can understand what their local conditions are. They can become advocates and they can engage in different activities, planning documents, those kind of things, so that they can make the case for cleaner air in their community. So with that, I'll stop and turn it back to Elise, but thank you for taking a listen on the state of the air, and we'll be happy to share more information on that as needed.
Perfect. Well, thank you so much, Will, for that really helpful overview. All right, so now I will introduce our next speaker, who is Olga Bakun. Olga is a manager of grassroots advocacy at the American Lung Association, and she has experience working on health policy, including issues such as tobacco control and access to care. And so now I will turn it over to her to talk about her analysis of the state cancer plans.
Thank you, Elise. Appreciate that. So I'm going to shift gears a little bit to talk about healthy outdoor air in state comprehensive cancer control plans. You may have heard some of this information from one of the previous webinars in our state comprehensive cancer control plan series, but for a little review, the Center for Disease Control and Prevention, or CDC's National Comprehensive Cancer Control Program gives funding and guidance to states to implement cancer control plans so they can address cancer in their states. And we wanted to see which states address air quality objectives in their comprehensive cancer control plans. So I reviewed the comprehensive control plans for all 50 states and DC and compiled the air quality goals and strategies that were used by each state in the plan. Next slide, please. So let's talk about what those objectives were that we were looking for. Working with colleagues on the Healthy Air team at the Lung Association, we developed a list of potential outdoor air quality goals and strategies to achieve those goals in the plans. And then I reviewed each state plan for those objectives. I do want to note their language often different from ours, but I categorized them as closely as possible to this list. So there were several goals that we were looking for. One was to reduce individual exposure to outdoor air pollutants. Two was to reduce overall outdoor air pollution, or on the other side, improve outdoor air quality. And three, we were looking for language on reducing disparities in outdoor air quality. And there were a number of strategies we came up with that might be in these plans that we wanted to check for. Those strategies were to improve access to environmental and/or occupational exposure information, to invest in mass transit or active transportation, to address environmental injustices in air quality, to support use of renewable energy, to support low or zero emission vehicles or the infrastructure for those vehicles, advocate for climate change or to address climate change, to support air quality monitoring or enforcement, to improve air pollution standards, to clean up industrial carcinogenic emissions, to prioritize clean power deployment, to decrease reliance on fossil fuels, to increase education and research, to strengthen public protections, to set clean or renewable or clean peak standards, and finally, to electrify buildings. So there were a lot of different strategies that we were looking for in these plans to achieve the goals. Next slide, please. So let's get into the data a little bit. First, I wanted to talk about when the state comprehensive cancer control plans were ending as I was looking through them. So in purple, we can see the states whose plans I was looking at that were current. In pink are the states whose plans were set to end in 2025 as of this data analysis. And then in blue were all the states whose plans I was looking at that had already expired. So we can see 10 states' cancer control plans had already expired by the time I was looking through the data. Next slide, please. So what did we find? Let's start with outdoor air quality goals. In purple, we can see the state that had more than one outdoor air quality goal. In pink are the states that had at least one outdoor air quality goal, and in white are the states where I did not find any outdoor air quality goals that we had mentioned in the state comprehensive cancer control plan. So we can see most states did not include those air quality goals that I was looking for. Just 9 states had at least one outdoor air quality goal, and only one state included 2 of the 3 goals I was looking for to address air quality in their comprehensive cancer control plan. And that was Oregon. However, I do want to note that that plan had expired by the time I was looking at it. So what were our findings? States that had language on reducing individual exposure to outdoor pollution was a total of 3. Reducing outdoor air pollution overall or improving outdoor air quality, that was in 6 state comprehensive cancer control plans. And language on reducing disparities in outdoor pollution was in 1 of the state plans. Next slide, please. Now, there was a lot more language on those strategies. So let's dig into the strategies to achieve those goals. In pink, we can see the states whose plans had between 1 to 3 of those outdoor air strategies. In purple, we can see the states that had between 4 to 6 of those strategies we had discussed. And in white were the states where I didn't find any language on the strategies we had discussed in their state comprehensive cancer control plans. So 22 states and DC had at least one outdoor air quality strategy. 4 states had at least 4 outdoor air quality strategies. So those states were Colorado, Iowa, Illinois, and Pennsylvania. And I'll go into the findings a little bit more detail here. The most common strategies that I found were to improve access to environmental and or occupational exposure information. That strategy language was found in 13 state comprehensive cancer control plans. The second most common strategy was investing in mass transit or active transportation. That was in 12 state plans. However, I do want to note that that strategy was generally under the plan's overall goal of addressing obesity and not necessarily addressing healthy air. And then the third most common strategy that I was able to find was language on addressing environmental injustices that contribute to poor air. That was found in the language of 9 state plans. So those were the top 3 most common strategies I found. Other common strategies were supporting low or zero emission vehicles, standards or infrastructure, which was in 4 state plans, improving air pollution standards. That strategy was in 3 state plans, cleaning up industrial sources of carcinogenic emissions. That was in 2 state plans. A few other strategies that I found, at least in 1 state, were advocating to address climate change, supporting air quality monitoring and enforcement, and supporting use of renewable energy. So that is the overall data I was able to find in the state comprehensive cancer control plans on outdoor air quality. Thank you so much, Elise. I'll pass it back to you.
Awesome. Thank you, Olga, and thank you again for all your work and your analysis of those plans. I know that's super detailed, and so we really appreciate that. And so now I'm delighted to introduce our next speaker, who is our guest speaker, Audrey Tran-Lam. Audrey directs the Environmental Health Program at the University of Northern Iowa's Center for Energy and Environmental Education. Since 2017, she has been working to raise awareness about the ways in which Iowa's environment impacts public health. Audrey holds a master's degree in public health from the University of Iowa and a graduate certificate from Johns Hopkins Bloomberg School of Public Health and Food Systems, the Environment, and Public Health. And I will go ahead and turn it over to Audrey.
Awesome. Thank you so much, Elise. And thank you so much, Will and Olga, for your presentations. It was really, really helpful for me. I learned a lot. And I just want to do a double thanks to Olga for that analysis. It's such a tedious thing that you did, and it was just so helpful picking through all of these plans that don't necessarily have a very similar structure to find what it is that you're looking for. Is really an amazing job. So I'm going to tell you a little bit about the process that I was involved with in Iowa with the development of the 2023 to 2027 Iowa Cancer Plan. And I'm going to be very honest with you. I'm actually a little bit nervous to be giving this presentation today because I'm not a cancer control professional by training or profession. And I'm not an expert by any means in lung health or lung disease. So I do feel a little intimidated by this platform and giving this talk. But hopefully you'll learn a little bit about the process that we took here in Iowa, the last iteration of our cancer plan, to include some of these really important air quality goals and strategies. You'll find as I'm talking that the presentation that I'm going to give, it's going to focus on environment and environmental factors and risk factors for cancer development in our state, because that was sort of the route that we took to get a lot of aspects of environment, including air quality, into our plan. So I'll be talking about how we thought about environment to get these very specific goals in our plan. Okay, so next slide, please, Elise. This slide, mostly for my accountability, this is my overview that I'm hoping to stick to. I'm going to introduce you to the Iowa Cancer Plan and the Iowa Cancer Coalition, or the Iowa Cancer Consortium. I'll talk about my role, albeit pretty small, when you see sort of the scope of our cancer plan and sort of how I was involved in thinking through some of these strategies. I'll tell you about the process as I remember it. As I was thinking through the content for this talk, I realized like, oh, this happened quite a long time ago. And so we'll see how much I can actually pull from my brain to be helpful to you all. And then I'll talk about the challenges as I'm remembering them, for things that we sort of felt were stumbling blocks for our, I guess not our stumbling blocks for participation, but the things that we ran into that made participation trickier than we were, I think, originally anticipating. Okay, next slide, please. So the Iowa Cancer Consortium is our statewide comprehensive cancer coalition, and it's the home of our cancer plan. The Iowa Cancer Consortium is the body responsible for coordinating the writing, teams, and the data, and the structure of the plan and how it will be presented to the public. So whether it's going to be printed or online, like they make all of these amazing decisions, and it's a huge undertaking. You advance the slide one tick, Elise. Not enough great things can be said about the Iowa Cancer Consortium. I truly mean this, and I feel like it's a very, very important thing that I talk about when I discuss the process that we went through, is that they have created such a culture, a welcoming culture to all of their partners and their members, that people like me, right, again, not a cancer control professional, can engage with this organization to help create these goals and set the goals for Iowa to try to reach when it comes to chronic disease reduction in cancer development. So I always feel very, very strongly about making sure that everybody knows that part of the magic of the work of the Iowa Cancer Plan comes from the culture of the consortium itself and the incredible staff that really welcomed us in to help put this document together, this plan together. Okay, so let's go to the next slide, Elise. For those of you following along at home, maybe you can open a separate tab in your browser so you can take a peek at our plan. If you go to canceroiowa.org, at the top of the screen at the home page, you'll find a little button for the cancer plan. And you advance the slide one time, Elise. If you click on this big blue button there, that will take you to the cancer plan. If you go to the next page, Elise, it will take you to this landing page. Along the left side of this page is all the chapters in our cancer plan. If you advance the slide once, the section that I helped to coordinate is located in chapter 2, which is prevention and risk reduction. Advance the slide one more time, Elise, and then you can advance it 2 more times. Priority number 6 is, when I said earlier that I played a very small role, this is the small role. This is priority 6 in chapter 2 is where a lot of the air quality goals and strategies show up. Like Olga mentioned, some of the other areas that may be of interest to you to check out has to do with physical activity, which is in priority area 2. But I will be focusing on priority 6 because this is sort of where I had my fingers and in some cases my toes involved in putting this together. You'll see here in the chapter 2 overview that, very common aspects of statewide cancer control plans are. There's priority number 1, reduce exposure to tobacco and secondhand smoke. Priority 7, reducing exposure to radon. And in terms of sort of environmental health in general, priority number 8, reducing exposure to UV light, right? The Iowa Cancer Plan, I think, is pretty unique in that it has broken out other environmental carcinogens of concern into this priority area 6. And I'm very excited about it. So I like to point that out. Okay, so we can go to the next slide, please. So the process, as I was involved with, the Iowa Cancer Consortium invited me to sit on the steering committee because there was increased interest from their membership, the steering committee for the cancer plan, I should say, because there was increased interest in their membership in environmental health topics and how environment may be influencing cancer development, cancer risk factors for Iowans. Part of the reason I may have been selected to sit on the steering committee is because I'm a little bit of a squeaky wheel when it comes to environmental health topics. Again, I'm not affiliated with the Cancer Consortium, right? My role is as an environmental health program lead at the University of Northern Iowa Center for Energy and Environmental Education. And so I was invited on, again, not as a cancer control professional, I helped to facilitate some listening sessions during the Iowa Cancer Consortium spring membership meeting to identify areas of interest relating to the environment for the cancer plan prior to the start of writing it. I helped to convene meetings of the writing team for Priority Area 6 and worked along the cancer control or the Cancer Consortium staff as the plan started taking its final shape. So there was a lot of writing, there was a lot of revisions, there was a lot of sort of back and forth about the things that our writing team thought was really important to include, but ultimately, what was the plan going to look like and how could it parallel the other sections well? So there was it was very iterative. Okay, so we can go to the next slide, please, Elise. Here's an example of what some of that feedback from those sessions looked like. There was also a survey that went out to membership that wasn't able to attend the spring meeting session, but we took the information from participants on a Jamboard, RIP, we missed those Jamboards. You'll see it's a very wide, broad smattering of different types of inputs, right? We have questions here. Some of the input is very, very specific. I'm looking at, there's a yellow sticky note in the middle of the sort of left-hand side of the screen. It says, keep goal H, page 26. It got very, very specific, the kinds of feedback that we were receiving, but then also very, very zoomed out feedback, like, we need to be focusing on primary prevention, upstream solutions. We need to be thinking about the precautionary principle and how to weave that into environmental carcinogen risk reduction. Again, lots of questions, but I share this only because I want to share one of the challenges that we received sort of as a writing team. Just how do we synthesize this kind of information into key priority areas or strategies in our priority area number 6? Next slide, please, Elise. I also wanted to share this slide specifically asking about challenges that the Iowa Cancer Consortium membership saw when it came to environmental health, and including it in the cancer plan or addressing it in some way from a cancer control perspective. And a lot of the feedback embedded in all of these sticky notes has to do with kind of communicating risk, communicating the evidence as it is, and then what does it mean to actually act on it? Where's the capacity? How do we engage partners in doing this together? A really important piece of information that I should have shared maybe a little bit earlier is that the Iowa Cancer Consortium isn't the sole body that's executing the cancer plan. They put this plan together, and it's sort of the responsibility of stakeholders across the state, all Iowans, to make sure that this plan is achieved over the 5 years that it's sort of not expired. Opposite of expired. And so this was part of the challenge here is communicating and making sure that we could try to make tangible goals and strategies out of some really, really important feedback from people, and then figuring out how to divide the capacity among all of the people who are interested and passionate about reducing environmental risk factors, including air quality. Okay, let's move to the next slide, Elise. And this is a slide that I just apologize in advance for, because I think it breaks all of the rules for slideshow presentations, right? Too many words right away. But I wanted to condense all of priority 6 in one slide so you could see the text in one place. Each strategy, so A through F, has sub-bullet points, these action steps. Strategy A has 3 bullet points underneath it. Strategy B has another 5 or 6. I have reproduced the sub-bullets that explicitly mention air for you all to look at. So under strategy C, there are 2 action steps that reference air. Strategy C is to reduce exposure to known and probable environmental carcinogens and investigate not yet identified sources of exposure. And then you can see that the action step underneath, the first one is to support the initiatives that reduce the pollutants or the carcinogens in water, wastewater, drinking water, and air. And then moving on, it's to reduce the fine particulate matter, ozone, et cetera, and to improve both indoor and outdoor air quality across the state. Again, under strategy E, strategy F, there are 2 more strategies relating specifically to So I feel like I'm running out of time here, to air pollution. So I may pause here and let you all revisit this slide, or we can talk about it again in Q&A, but I want to move us forward to talk about, I'll give you a quick summary and then wrap up with the challenges, and then we can revisit this. Hopefully you all are following along in a separate tab anyway on our amazing Cancer Consortium website. So Elise, could you move me forward one slide, please? So, oh, I'm sorry, move me back. I hadn't realized that you would, thank you so much for anticipating that. So as in terms of a quick summary here, I just want to share that, UV, radon, tobacco, usually very well represented in these state cancer plans. But I think that Iowa has been relatively unique in that it's broken out, it's pushed past those three sort of more traditional environmental factors and included things like environmental carcinogens that may be experienced in water and in air, and really just opening the door for Iowans to be addressing the emerging health harms, chronic disease, cancer contributions of what we're experiencing in the environment in our state. And very explicitly, this is a starting point. We didn't have a ton of examples in the rest of the state cancer plans throughout the nation to draw inspiration from, language from, ideas from, figuring out how to set data targets, right? We were figuring this out sort of by ourselves. And so this is absolutely a starting point. And the having language like this in our cancer plan in and of itself is sort of reaching the goal to raise awareness of its importance to Iowans. Hopefully that made sense. Okay, so Elise, move me forward to my second to last slide here. So the challenges that I feel like maybe are important, very important to highlight, are just some general insecurity that the writing team and I had as we were putting this section of the plan together. We really wanted to meet the expectations of the cancer control community, and environmental health as a field isn't known for being extraordinarily clear cut. There's a lot of co-exposures, emerging evidence, a lot of epidemiology that may or may not meet the threshold that maybe people who are like living and breathing cancer control are super comfortable with using to act on. A lot of us who work in environmental health see emerging evidence as kind of like from a precautionary principle lens. We see the evidence and we need to act on it as soon as possible. So there, it did feel like we were really trying hard to meet the expectations of our cancer control professionals, and also navigate communication differences coming from two different fields. I think professional jargon, this is going to be an issue that multidisciplinary stakeholders meet whenever they collaborate. It also was extremely difficult for us to find existing data to set benchmarks. This section of the Iowa Cancer Plan has one of the fewest data targets in the plan, which makes the content of it feel somewhat intangible, which I don't necessarily see as a like flaw in any way of the section. It just means that we have some work to do, and a lot of the work that we need to be doing is setting baselines, right? We also ran into challenges as a writing team in figuring out what to include versus what to omit from the plan, and so we opted to stay very broad to allow the cancer control partners in the state of Iowa and the partners that maybe traditionally haven't been engaged yet to take a bite out of what felt right to them to engage with. Keeping it broad instead of very, very specific helped, I think, to illustrate that capacity could be distributed among the partners. And so my thoughts for the future, very, very quickly, I know I'm pushing time here, is to, if you work in a cancer coalition in your state, is to really encourage your partners and folks who maybe aren't currently at the table to step into their expertise, because I think this multidisciplinary collaboration really does strengthen the plans, and I think it has in Iowa. And new partner engagement really is needed to increase that capacity that I mentioned earlier in addressing environmental health and air quality in these plans. I think that plans built out air quality or environmental health sections helps troubleshoot for the rest of the country when they want to be writing their own plans, because it gives them a sort of a bank of ideas and language and just lessons learned to draw from. Like I said, we had a very limited amount of cancer plans to emulate when we wanted to do something like this in Iowa. We really did feel a little bit alone in trying to figure it out. And then states who have surveillance data, really great network of environmental surveillance data, I hope that motivates you to be putting these types of metrics or these goals and strategies in your cancer control plans. If you have an amazing air quality monitoring network, that should be a huge motivation to make sure that a strategy gets into your cancer plan, because it can be tracked. If you can measure it, you can manage it. We just didn't have that here. So a lot of the work that we need to be doing as a state is to start doing that benchmarking. So we can go to my last slide. Wrap this up really fast. I'd love to continue the conversation. My contact is here if you'd like to follow up, but thank you so much for your attention. And I'm really tickled to be able to share this with you all. Thank you so much.
Thank you so much, Audrey. Really appreciate that presentation, and it was so interesting to hear about the process. And I think it'll be really helpful for folks in the call who are working on state cancer plans in different states. And anyway, so thank you again so much for that wonderful presentation. So now I'd like to spend a few minutes talking about some clean air resources from the American Lung Association. So as Will mentioned at the beginning of the presentation, our State of the Air Report is a national air quality report card we release every year that puts air pollution into everyday language, gives the public local information about their air quality, and includes the latest research on how air pollution affects health. To read this year's report and to learn more about the air quality in your area, you can visit lung.org/SOTA. If you'd like to learn more about air pollution, the American Lung Association's website, lung.org, is home to a wide array of resources where you can learn about common outdoor and indoor air pollutants, as well as what you can do to address air pollution and minimize a harmful impact on yourself, your loved ones, and community. Check out lung.org/clean-air for more information. I also want to take a moment to highlight our emergency and disaster webpage. Wildfires, flooding, hurricanes, extreme heat, and other unexpected events can create harmful air quality and pose a risk to lung health. Our emergency and disaster resources webpage provides information and tips to help you prepare and respond in case of an emergency. You can peruse these resources at lung.org/disaster. Additionally, I'm excited to share that the American Lung Association recently launched a new Climate and Health Basics course. The purpose of this free 1-hour course is to educate people about how climate change affects your health, including your lung health, provide strategies to reduce risks for yourself and your community, and promote climate actions that help protect human health. To register for this course and to learn more about our other health education courses, please visit lung.training. And then finally, I'd like to plug our Health Professionals for Clean Air and Climate Action community and monthly newsletter. The newsletter is a great way for health professionals to stay informed about the Lung Association's clean air advocacy efforts and features climate and health news, resources, and ways to take action. You can learn more about this community and sign up for a monthly newsletter at lung.org/climatechangeshealth. All right, so that concludes today's presentation. And now I'd like to invite all of our speakers to come back on to video. And we'd love for everyone who is attending today to please put any questions you may have in the chat. So thank you again so much to all of our presenters. That was really interesting. And I think while folks are thinking about their questions, it looks like we don't have any questions quite yet. But I will kick us off and ask Olga one question. What surprised you most in your analysis of all the state cancer control plans?
Yeah, I didn't know what to expect when I went into it, but I did think I would find more language on it overall. About half the states, I didn't find any language in their comprehensive cancer control plans. So I just thought it would be a little bit more robust.
Thank you. All right, looks like we don't see any questions yet, but I will throw another question over to Audrey. Audrey, what is one piece of advice you would give to folks on the call who work on state cancer plans and want to incorporate a goal or strategy related to air pollution reduction in a future plan, but may not know where to start with that?
Yeah, that's a great question. Thank you so much, Elise. I think that I, you know, I'll say what I said, I think earlier in my presentation, which is that talking about environmental health broadly, environmental risks as it relates to cancer, really opened up sort of the permission we had to include air quality in our cancer plan. And so I would really encourage thinking as upstream as possible about the environment to sort of jumpstart that air quality conversation. I also do think, just for me, listening to like especially Will giving his presentation on particular like types of air pollution of concern, I think we could get a lot more specific in our strategies and action steps in the Iowa Cancer Control Plan in the next iteration by inviting people who aren't just, interested or experts in environmental health, but people who are actually air quality experts to the table to help us refine some of these goals a little bit better and help translate the science into cancer control speak. So I think that just inviting as many people as possible, as many multidisciplinary stakeholders as possible in the process, it can be tedious and it can slow things down, but I think it will make just so much more of a robust plan that many people in the state can sink their teeth into to help move the needle in cancer risk reduction for your state.
That's super helpful. Thank you so much. And it looks like we had one question in the chat for Olga. It looks like you already mentioned it, Olga, but I'll still read it for the group. Did you contact environmental health programs or state implementation plan administrators in each state as part of your review process? Do you want to expand a little bit about that, Olga?
Yeah, no, I think those are great points. For the data collection, we only referred to the state plan itself and the language in there, but that doesn't mean there isn't other work being done in the state. Yeah, thank you, Mary.
Thanks so much, Mary. We do have a little bit more time for questions, so I'll give it another minute or so. If anyone is still thinking about questions, please feel free to put them in the chat.
I have a quick question, if that's okay, Elise.
Of course, yeah, please.
Also for Olga, I'm curious if you or really anyone at the Lung Association, if there's any one of your colleagues, maybe in a different organization or coalition, that has looked at state cancer plans for like other reasons. Like I have an interest in environmental health, so I'm curious about where water quality is showing up and things like that. So it would be such an important service to sort of collect all of this data so we can see where these major gaps are. Understanding, of course, that gaps will differ based on region, based on state priorities or risk factors, but just curious if you know of any other groups that have looked at these state cancer plans for other reasons.
I can say internally, as part of this series, we also looked at radon and we looked at lung cancer screening in the plans. I'm not as familiar with our partner groups. I don't know if you're more familiar with any work being done in that space with our partners.
No, certainly would be interested in that broader analysis too, but I'm not familiar with others looking at it.
Great question, Audrey. Thank you for that. It looks like we do have one attendee who has a question, but unfortunately we aren't able to take folks off of mute. So if you do have a question, please feel free to put it in the chat and we will do our best to answer it. And Kelly, if you're not able to put it in the chat, I can always contact you separately. Oh, looks like she had a comment. You can use the cancer control search on the CDC site, but it has been down since the summer application offline.
Thanks, Kelly. That wasn't on my radar. I appreciate that.
Thank you for letting us know. All right, well, it looks like we don't have any other questions. If you do have questions that come up after the webinar, please feel free to reach out to me and I can always touch base with our speakers. So I want to say thank you so much for attending today, and thank you to our speakers, and really want to say a big thank you to everyone on the call who was able to join. And I know many of you have attended all of the webinars in this series, so we really appreciate your interest in this work. And for folks on the call who work in the cancer control space, we are incredibly grateful for everything that you do to reduce the burden of cancer. So thank you again for joining. Like I said, this webinar will be recorded, so we will share the recording following the event once it's ready. So thanks again, and hope you have a great rest of the day. Take care, everyone.
Thanks for the invite. Thank you all.